Thank you, Mayor. I'm going to hit on a couple of things. One is our hospitals. Our hospitals are quite full. A lot of people have unfortunately been using them as warming centers. Hospitals are not warming centers. The emergency departments are packed full. The hospitals are full. If you have a serious medical problem, you of course call 911. Do not call 911 for things which are not emergent. Please recognize that a hospital right now is not a good place to go to get warm. There are other warming centers around, and the hospitals are quite full. In many of the warming centers, they have electricity. So if you are somebody who is dependent on an electrically powered device and you need to get warm, you can go to those places, but be sure you bring the things that you need to charge your batteries and to run your equipment. We've had people show up with their equipment but not their batteries, and so now they don't know how they're going to get home because they didn't bring them with them to get them charged when they had power. So I'll be thinking ahead about that. Also, if you're going to go to a warming center, make sure you bring your medications with you. We don't have much medical infrastructure at these places. We certainly don't have pharmacies, so make sure you bring your medications with you if you're going to go to a warming center. Again, the hospitals are also dealing with the same issues in terms of power outages and low pressure. If you are a dialysis patient, the hospitals are not going to be able to provide you dialysis because they don't have the water pressure. We are working with the major dialysis providers in the community to get them water pressure back online, and we're hoping that we'll be able to do that shortly. Director Haddock already talked about how the water pressure may be coming up soon, hopefully by this evening and more so tomorrow. And dialysis centers hopefully will then be able to get back online with that. So if you're a dialysis patient, work with your dialysis provider and make plans to get dialyzed with them. The dialysis network in Texas actually is very well coordinated, so that if you are a patient of one particular dialysis provider, they are working together and they are caring for each other's patients as they have capacity to do it. So they will work together. You may find yourself being directed to a place for dialysis that you don't normally go to. That's okay. That's being coordinated, and we've done that before during hurricanes and so on and so forth. I want to reinforce something that Chief Pena brought up about carbon monoxide poisoning. Carbon monoxide poisoning, we've had more carbon monoxide poisonings here recently than I can remember any other time in my career. This is a odorless, tasteless gas. Early symptoms include headache and fatigue and nausea, and people have lots of reasons to have headaches right now and to be exhausted and to be nauseated, so they may not recognize that they're getting the early symptoms of carbon monoxide poisoning. That is then followed by confusion and altered mental status. So if you are with someone and you're using a barbecue, whether it's indoors or even outdoors, and somebody starts getting confused, you need to get them to fresh air immediately. We've had several cases of people that have been outdoors using barbecues to stay warm in an outdoor environment and have got carbon monoxide poisoning. So the chief pointed out that it's dangerous indoors. It can also be dangerous outdoors if the setting is exactly the right way, so that where you're sitting isn't ventilated very well. And then finally, last thing about the boil water notice that Director Haddock pointed out, there are opportunities for commercial establishments to still function during a boil water notice, but they have to follow all the same issues that would be used anywhere else. So if you are a commercial food provider or restaurant, you need to discard the ice that was in, that your automatic ice makers may have made. You need to discard that. You cannot use that. It may have contaminated water in it. You can only serve bottled water. All right, only serve bottled water. And as Director Haddock pointed out, if you do have power and you can boil water, you can use that and you can store it to be used later. But you cannot use anything that came from the faucet during the boil water notice, even that came through one of the machines. And if you have questions, you can contact the Houston Health Department, our Consumer Health Service. The email address is CHS, an abbreviation for Consumer Health Service, CHS@HoustonTX.gov, or you can call 832-393-5100. Again, this is for commercial establishments. This isn't for residential help. This is for our folks that work with restaurants and commercial food providers, to provide them support and how they can continue to function during the boil water notice. And again, finally, just everyone, this is, look out for your neighbors. We know who our neighbors are most at risk. Go by, knock on the door, see how they're doing. If you have some support that you can offer them, please do that. Yeah.
Thanks, options for people needing transportation to outpatient healthcare treatment. Is 311 up and running and able to give residents transportation information for healthcare needs?
Yeah, so for most of the outpatient clinics that I'm aware of, they are not open. They have the same problems. They have power issues, they've got water issues, and so as far as I know, most of them are not open. So if you have an appointment, try to call ahead. You'll probably get a recording telling you that they're not open. In terms of transportation, no, there is no additional thing. No, Metro has been helping us out in some specific situations, working with HPD and our comm center in very unique, you can't make this stuff up kind of situations. Metro's been able to help us out with that. But like I said before, so the hospitals are not a good place to go right now because they're overwhelmed, and they're not a good place to go for primary care anyways. So we're just going to have to wait until those clinics start opening up, and hopefully when that happens, the transportation grid will be back online as well.